we're going to make sure. I want to make sure these are all clean. We're going to start with those two. We're also going to go around this elbow. So we've got a number of channels here, right? Definitely like liver, spleen happening in the knee here, bladder channel in the back, right? Then we've got stomach and spleen in the kneecap. So yang, ming, tai yang, right? We're all name pair extremity image. So elbow, tai yin here, so we're going to be lung 5. Yang ming here, we're going to be large intestine 11. We're also maybe going to need pericardium for liver going on the inside, so that's PC3. It also kind of radiates down into this this pes anserinus, which isn't her worst spot, but that pes anserinus is maybe the attachment of this bicep tendon. So we might be somewhere here, kind of deep. We'll see what we see how we do there. And then the back of the knee, bladder, tai yang is going to be SI. So we really need SI8. A little bit hard to get to here like this, right? So the ideal situation is if we're able to get her arm comfortable and slightly off the table. Is that comfortable?
Mm-hmm.
Well, it doesn't feel like it's going to fall off?
No.
Perfect. So now we actually have access to SI8, and we can slide it down the channel, not into the nerve, right? Not into the nerve. Okay. Let's try all that. I think we'll start with the SI8 since it's a little farther back. So we're going to locate the bony prominences on either side of where this ulnar nerve runs. And we're going to insert here. Is that okay?
Yep.
Any tenderness or pain to that?
No.
And there's SI8. And let's do large intestine 11. So far, so good?
Yep.
Excellent. And between SI11 and LI11 and lung 5. So this between spot to me is basically where the patella is, right? Because yang ming tai yin, patella in the middle of sesamoid bone. No sesamoid bone, but that's where it would be anatomically if that's where we were treating. And then lung 5 here. We go a little bit farther on that one. Because we want to get close to joint space. So there's that. Okay?
Mm-hmm.
Very good. She's got a little bit here of pes anserinus. So we're going to go a little bit lower where that attachment might be at radial tuberosity. There, and I felt radius there, actually. So good. And it starts a bit higher on the medial thigh, maybe liver, spleen area before it comes down to the knee. So we're going to come up a little bit onto the upper arm, maybe somewhere about here in the middle of the bicep muscle. Maybe one more closer to it. Good, let's do that. So kind of peppered the area of the elbow there a little bit. I would like you to try to bend this again and let's see if that...
Oh, wow.
Is there a difference?
Mm-hmm.
Okay, great. So do you still feel it in the back at all?
Not like I did, but
Okay.
it's still there.
Still
but
there, but how much less would you say in the back?
From like 100% back down to 25, 30.
Oh, it's a big change.
Yeah.
Great. So, and not as tight?
No, not as tight.
How about the front here? Are you feeling pain there still?
A little bit,
or
not
the inside?
Not like I was.
So where do you feel it now?
I feel it in the back here. Okay, still.
Okay, a little bit to the lateral side of bladder 40, so bladder 39 more like. Okay. Anywhere
Yeah.
else? Not in the front so much?
No.
Great.
Wow.
Cool. Thank you for being here. Try not to
Sure.
move the elbow.
Yeah, I see you.
You felt that a little bit?
Yeah, I did.
Now,
Don't
now,
wanna
now,
move.
now you know. Right?
Yeah.
Sometimes we learn by example of ourselves moving.
Yeah.
I always forget and move personally. So I think that was more here, maybe this kind of area here, tender. Yeah, that one. So it's kind of the tendon, almost gallbladder, right? Very close. So we're going to try to find something between Taiyang and Shaoyang. So we've got a couple things going on here. This is a bit in the way. Olecranon. So we're going to look maybe along here, and we're going to look a little bit more on this SI. I really like these SI points. There's a lot going on that you can do here. There's another mastodome point called Shinmun, which is heart gate, which goes in this way. So we might look at that. We're going to also palpate along this, what I'm considering Shaoyang for me. So this is more like gallbladder coming this way, but hers is kind of in between gallbladder and small intestine pain on that knee. So we're going to kind of look in this area. So let's palpate that before we come back with points. So we have to be careful to palpate with the needles already in, right? So we're gonna, is this tender at all?
No.
No. Is this tender at all? Not really. Is this tender at all? No. And it's kind of tendony back there. There's not a lot of tendon over here. How about this one?
A little bit.
A little bit. So now I'm kind of at an attachment, and that's what a tendon's attached to bones, right? So now we're getting a little bit of a tendony sensation here. This very well might treat that. Olecranon to me is basically head of the fibula, so we're kind of like around the head of the fibula here. Hers is a little bit behind that, actually. So the other side is really kind of where I want to be, actually. So we're going to look over here and see if we find tender stuff. How about on this side? Not really. How about down here? Not really. How about over here?
A little bit, but not
A little
really.
bit. I'm guessing I'm going to go more of that Sheen Mun point, kind of that heart gate, because we're going to get some small intestine again, and it's fleshy, and she's kind of having swelling back there. So we're going to use this one, and that's again 1.5 inch. Try the bend one more time. Let's see if that changed that outside.
Yeah.
Less again.
Yep. Less.
Excellent. So one other thing I want to do for your knee, because we know that there's a inflammation and swelling long term, we're going to use this Masterdome protocol that is a PC6 on the opposite side with a liver 3, kind of a high liver 3 on the same side. And that's his protocol for specifically swelling of the knee. I think the idea is that the that knee conditions are related to circulation. I think some people translate that as actually a heart condition, but it ends up being circular. To me, that's vascular, which means circulatory. So it's actually, to me, a circulatory lack of blood flow. It's almost like the knee's sort of a bottleneck, right? All these large vessels coming down, and they have to squeeze down in the knee, and so you just don't get that much blood flow. So it squeezes down, and you get swelling, and we just want to increase that blood flow. So we're going to use the pericardium 6 to help. So this one goes between 2 tendons. You might get a little bit of a shock into the palm here.
Mm-hmm.
We'll try not to do that. But if you do get it, I'm sorry. Is that okay?
Yeah.
Great. We don't have to get the shock if we don't need to. And here's this high liver 3. So liver 3 right in the middle. We're going to go at the juncture of the metatarsals here, like that. And we're going to go straight to kidney 1 with it, right there. And there wasn't, did you feel much with that?
No.
Yeah, so not a lot of needle. I want to get a little bit more on this. I want this to reaction. For me, there's an artery deep to this point, so I want to stimulate and get the tissue around that artery to react. So we're going to rotate one direction until the tissue kind of grabs it, or she tells me to stop. So if this starts hurting, let me know. We don't want it to hurt. We just want it to ache a little bit. Any achiness?
Nope.
So I might feel it. It's still pretty loose. We're going to keep winding here. There, it's getting tight.
A little bit.
A little bit. That's enough. The needle has stopped winding. It's gripped. So oftentimes we will feel that on the needle before the patient will feel it. So oftentimes they're confused, like, how did you know that that's when I was going to feel it? Well, because the tissue changed under the needle, right? So that's kind of what we're going for. Okay, excellent. So that's the first one. So that would be my knee protocol for her, and I would leave this. I'm going to want her to bend this every 10 minutes. About 10 pumps is what I call it. So I want her to, if this knee was really swollen with fluid, right? It's swollen because of our throat, right? But if it's swollen with fluid, we would actually see that fluid swelling go down during the treatment. So they may start out with a range of motion stuck because of the fluid, and as they bend it and pump it and squeeze the fluid with these 2 points, it's like it's pushing and circulating the fluid out, and the knee just gets better and better in its range of motion, and the knee gets, and the pain gets less and less. And it stays that way amazingly. So after a couple of these treatments, oftentimes that knee swelling is gone for a good many weeks, even months sometimes for the patient. So it depends on what they do and how much they walk, of course. So every 10 minutes, 10 pumps, and literally like pumping a water well. You know, like you're squeezing and squeezing and squeezing the water. You're pumping that knee and right, kind of squeezing it to increase its range of motion as the fluid's getting pressed out of the tissue over, again, 45 minutes of the treatment. So they do that maybe 4 times during the treatment. So we'll do that in a minute, but we're not done with you quite yet. So we found some tenderness on this side. Was that right? We found some erector muscle in the back. We found some pain definitely on the spine. And then there was a little bit here at psoas, a little bit at iliacus, and a little bit in inguinal ligament. So we're going to release that back muscle and see what shakes out. There may still be pain on the spine, but if it was where the muscle's attached pulling on the spine, it wasn't really a spinal problem, it was just muscle attachment. So we're gonna treat that first. And it is bladder channel we're treating. So bladder channel opposite clock width, lung, right? And so navel level, and we're gonna go below navel, right? So L2 and down. So this fleshy, meaty muscle is gonna treat fleshy, meaty muscle in the back, the erector muscle, right? So that's there. And then we're gonna go same side bladder channel, just like we did yesterday. And we're gonna do it from the back, almost kidney channel, but we're gonna angle them towards bladder channel, and that'll work just fine. So we'll do those two first. So far so good. Are we okay to continue?
Mm-hmm.
Thank you very much. So we'll do one about here. And to me, this zone is very large, so we can do pretty much anywhere in here that seems good. I sort of try to kind of bisect it. Sometimes I'll do a third one here or down here. Let's do 3 today. I'll do one here. Right? Good. Very good. So I like more than one needle in the same kind of area. It seems to increase the effectiveness of those points. Some people like to call those Dao Ma, being 3. I don't think 3 is important. I think more than 1 is important. So it could be 4, it could be 2, it could be, couldn't really be 1.5. So 2 or 4 or 5, however many you want. So we're going to go just a little below lung 5. Again, a zone here. And then 6 right there. How are those, okay?
Mm-hmm.
All right, let's see what happens. I'm going to come right where you are, so I'm so sorry. So let's check. Oh, wow, that's different.
Yeah, it's a lot looser.
That is. That's a soft tissue muscle now. It's not hard anymore. Very nice. Okay, how about on the vertebrae? Are these still tender?
Mm-mm.
No. Which is what we mostly find. Most of the time, you treat the bladder channel, the muscle relaxes, the spine lets go too. Any of those?
Oh, I feel a little on the left over here when you push
When
there.
I press here, you're feeling a
Yeah.
little on the left. Okay, so we're going to
Not on the left, but in the left.
on the left muscle.
Well,
What do you mean?
like an inch from where your finger is.
So more like
Yeah.
here.
Right.
So not this.
A little there, yes.
So a little bit on the spinous process, maybe L4, 3. How about this one?
It's better.
That was
A little
2.
bit.
How about 4?
Yeah, that's
a little
where
bit
it's
on
at.
4. Okay, so there still is a bit on the vertebrae, but more to that side.
Yeah.
Right, more to that side. And then let's see what the rest of it's like. So that was all okay. Let's see what happened here. How about this ASIS now?
No, it's not so much.
Not so much. How about deeper?
No.
Softer. How about here against the wall?
A little bit.
A little bit there.
Yeah.
How about going this way?
Yeah.
A little bit of inguinal ligament still.
Mm-hmm.
Okay, so that didn't let go. Let's see what happens when we let go of the spinal point. So now we're going to work on that midline, but just slightly to the left. I think it still is probably spinal, though. It could be the muscle pulling over on this side, so we might do that first. And we do have some lung points here that would have treated that already, right?
Mm-hmm.
Accidentally, funny enough. Double treatment there. How about this?
It's better.
Not real tender. So it's really very, very close to the spine.
It
It's,
is.
it's so close. It's either right at the attachment on the spine or the spinous process itself. And we could do bladder points on this side too, but since we want her to bend it, I find that with the liver 3 bending it is no problem. Points in the foot tend to not be a problem. Points in the calf are a problem to bend. So if we put these in, now she can't bend that anymore. We lose our knee treatment. So I will tend to, if I really need these, I will let her go half the treatment doing this, then come back and put needles in the calf points and finish off the back. For her case, I don't think we need it. We're going to go to the cervicals in the CV points in the front. So can I do a couple points in your belly?
Sure.
Thank you. So we're going to go right here on the midline. So I think that these points in the abdomen, actually anywhere on the midline, actually will treat the ligament as well on the spinous processes, because we've got the linea alba, which is the attachment, and it's a more dense connective tissue than just muscle. It's more like ligament. So we're going to go a little bit high here, say CV7. Very soft, actually, not very tight. And we'll do a second one, and we'll do a third one. Is that okay? Those are all soft. Is that one you felt a little bit?
Yep.
Okay. How about this one? We're going to wind those up. Good. We're going to wind this up. Good. I'm going to wind this one more time. Great. Those okay?
Mhm.
Perfect. Now we're going to palpate again. How about now?
That's better.
Not really tender. How about lower here?
Not like it
How
was.
about way down there? No. So,
Slightly. That's right there.
right here?
Yep.
Okay,
That's
so
the
that's
spot.
basically L4. So the point's there that treats it. It's possible that it's in between the 2 points, and these aren't getting enough of an influence to affect that middle one. We might have to put one there. But I'm going to manipulate these just a bit. So I'm going to I'm holding that spot with my finger, and I'm going to try to angle this needle. I'm going to back it up a bit and angle it pointing towards my finger here, right? So we're going to back it up a little bit. See, it's so loose. So we're going to angle it just a little bit like that, and then we're going to turn it again until we get a good achy response. I might go back and forth a little bit. Anything there? A little bit of achiness? We want kind of a deep ache. Not too much pain.
Yeah, it's
It
kind of
aches a little
radiating
bit.
to my hip now too.
Radiating to your hip. And then how's it now under my finger?
Yeah, that hurts.
Still hurts. We're going to try
And
a
I
second.
feel it down my leg now too.
Down your leg?
Yep, down my butt. You know.
And does that happen when you lie for long periods of time? or
Sometimes I get the
sometime?
sciatica.
You get like a ten. And so is that radiating down kind of this way into the hip? Okay. So we're going to treat the muscle next to it. Instead of using the bladder points, we're going to use a kidney line here. And we also don't want to lay too long because it sounds like things tighten up as she lays too long. So for her, I would probably have her in a recliner, more common than on a bed, because she's going to be a little less strain on the back. Is it aching pretty good right now? Or is
No,
it,
no.
When I stop pressing on it,
Yeah.
it feels okay. All right. So we'll do a second one on the kidney line here. And another one next to that. Mostly we want to leave this alone at this point. Turn those to get just a little bit of achiness. One more time on this one. A little bit more on that one. But this is the area we're working in to try to release this here in the back. So one more press.
That's better.
Not too bad now.
Mm-hmm.
Okay. On the side. And the tissue right next to the spine is really relaxed a lot. So that's nice. Okay, so we'll leave that like that. It's kind of a lot for a first time. We're probably going to leave her like this. If this was the main condition, I would probably go up here and do points along the rib to work on that inguinal ligament. I don't want to mess with her too much. So let's leave it like this today. Okay? Are you comfortable?
Yes.
Good for, well, maybe we'll leave you about 20 minutes.
Sure.
I do want you to bend this knee a few times. So
Yeah.
bring it up and bend it, and then we're going to have you kind of pump it just like this, maybe 5 or 6 times. Is it comfortable to do that?
Uh-huh.
Doesn't hurt anything? Perfect. And then after you do about 10 of them, let it relax again. And after 10 minutes, we'll do it again.
Okay.
Okay, perfect. Thank you.
Thank
You're doing
you.
great.
Thank you.